The other thing that is not slowing down, unfortunately, is the COVID-19 Delta variant. And we're seeing it spread rapidly and even doing some cases now where the younger population is starting to be hit with this variant of COVID-19. So I got a hold of our friends at Akron Children's Hospital and Dr. Eric Robinette, doctor of infectious disease at Akron Children's Hospital, kind enough to accept the invitation this morning to come on to the show with us. And Eric, why don't we start there? Maybe share your knowledge, what research and what the statistics are telling you as far as COVID-19 Delta variant in our country's youth, and specifically Summit County and Akron Children's Hospital.
Well, sure, Ray. Good morning. So, the Delta variant, we're still learning about it. Like, everybody's used to hearing that in the pandemic as far as we're still learning about it. But, we're definitely seeing that it's the predominant cause of COVID-19 infection in the United States now. We're seeing that cases and hospitalizations are trending up in Ohio, although they're still relatively low compared to where they were through most of the pandemic. They're definitely going up. And, children are vulnerable to COVID-19 infection. We know that from our experience through the whole pandemic. We'd expect that the Delta variant will behave similarly in children insofar as they'll also be vulnerable to it in the same way that adults are. And although children's rate of serious illness and complications is significantly lower than older adults, it still can make them pretty sick in certain cases, particularly the complication called MIS-C. And so it's definitely something that we want to do everything in our power to protect our kids from.
Okay, a couple of things coming out of that. Eric, let's talk about certainly keeping both eyes on this variant with the spread and the rapid spread of this variant. Are you concerned that the longer this hangs around that it could make a deeper dive into our youth population?
Yeah, absolutely. I think the more that it spreads, the more risk we have of other variants emerging and the more risk we have of local outbreaks. And so, yes, I think that that's definitely a possibility.
With us is Dr. Eric Robinette, again with Akron Children's Hospital. He is a doctor of infectious disease. And also get into the complication, and you mentioned it, that we're seeing with the youth population in regards to the condition that you've seen with the youth. If you could do that with me.
Sure,
with COVID.
Sure. So COVID-19 is a lot. So in adults, COVID-19's primary complication is a very severe respiratory infection, like a pneumonia that leads them to, need to go on a ventilator and things like that. In children, that's extremely rare. But what we have been seeing is something called MIS-C, which is a post-infectious autoinflammatory type of response that causes multiple organ systems to dysfunction, and it can make them very, very sick very quickly. Usually happens 4 to 6 weeks after COVID-19 illness. And we have seen a number of patients that have needed treated in our intensive care unit for that. We think that the rate is probably somewhere between 1 in 1,000 and 1 in 10,000 children who get infected with COVID-19 will go on to develop MIS-C, which is, seems low, but in a city with several 100,000 people in it, still is a significant number of sick kids.
Eric, there's a lot of parents that are a little bit nervous with the school season, now less than a month away for most of the districts, and certainly question marks. And I know a lot of the superintendents will give clarity on that in the weeks to come. But as a doctor of infectious disease, maybe talk to the parents about masking and such. Is that still a good idea in your opinion?
Yeah, so great question, Ray. So, I think the AAP, the American Academy of Pediatrics, said it really well in their statement, which is that we should do everything in our power to keep kids safe and get them back to learning in person, right? So we understand that the distance learning was not successful for a large number of patients, and that that lack of success was disproportionately affecting people that, kids that were already at risk of having, less successful school careers. And so, it was really important that we get kids back to school in person. So we're willing to do whatever we can to make that happen. And masking is an important part of that. The CDC still recommends masking for people who are unvaccinated. And, unfortunately, because we don't yet have a vaccine approval for kids under 12, that includes all the kids under 12 in an indoor setting like a school. And so, I think obviously the superintendents will be looking at their facilities, their local case rates at the time that they're opening school and throughout the school year, and kind of what their capabilities are. But yeah, I think that because the goal is to, number one, keep kids safe, and number two, get the schools to in-person learning, that masking is probably a good idea in indoor settings as recommended by CDC in most situations.
And Eric, you started to go down the path of my final question, but talk about that on maybe how close we are. I've been hearing that we're getting closer and closer to vaccine being available for those 12 and under. Are we closer, or what is the story there? What's research telling you?
Well, we're definitely making a lot of progress. So the clinical trials for kids 6 months to 12 years of age are well underway. They have thousands of children enrolled across the United States and worldwide. And so they're accumulating the data that they need to determine that those vaccines are safe. We're very, very optimistic that those trials are going to prove that the vaccines are safe and effective in children. They're a little more complex than the trials for 12 to 18-year-old kids because they have to try different doses because the children are so much smaller, and that adds a little bit of scientific complexity. But I think it's still very much a reason to be optimistic that sometime this fall we could see an emergency use authorization for kids under 12.
And then finally, Eric, let me ask you this. In regards to COVID/variant, are there different warning signs, symptoms for children, the youth, than there is for adults, or is it all one the same?
Kids tend to get less sick with the respiratory component of the illness, so it tends to be more like a cold in children. They don't tend to get that more serious flu-like illness that the adults tend to get. And so, the great news is we have tons of testing available. We're in a totally different situation than we were last fall when we had really limited testing available. So if your child is exhibiting cold-like symptoms, febrile illness, it's very easy to get them tested.
All right. Eric, thank you for the time. Great information this morning. Thanks for accepting the invitation with us.
My pleasure, Ray. Have a good one.
You as well. Dr. Eric Robinette, again, doctor of infectious disease at Akron Children's Hospital, and hit the reset button. Yeah, they're starting to see a little bit more, and he did say he is worried about the variant, the Delta variant that's out there. He said the longer this virus is allowed to live, the more mutation you can see and the more it could affect the children. And he also said they're getting closer with the vaccine for those ages 12 and under.